Coming up next on It's Personal, a geriatric clinic is being developed at Gundersen Health System, and this clinic may have a huge impact on our aging population. You'll learn more. Also, if you have prescription or over-the-counter drugs left over in your medicine cabinet, there is a safe place to drop them off, and it is the only one like it in the country. We'll explain. And a bit later, if you're not feeling well, when is it a good time to go to work or stay home? How do you know what you should do? We're going to talk with an urgent care doctor and find out. All next on It's Personal, brought to you by Gundersen Health System.
Wow, what a great game. But that meatball sub, it sure gave me heartburn.
You're sweating and breathing kind of hard. Are you sure you're okay?
So I got a little worked up over that last play. What are you, a doctor or something?
No, but I read that chest pain from a heart attack can be mistaken for heartburn. Does it hurt anywhere else?
My arm aches some, but armchair quarterbacking is a tough job.
That's it. You're going to the ER.
Is it heartburn or a heart attack? Gundersen Health System urges you to learn the difference. It could save a life. Go to gundersenhealth.org/chest-pain.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, how do you actually start a geriatric clinic and program? We're going to find out. Dr. Mary Bassing, she's the internal medicine and geriatrics representative here on the show, and she's going to talk a little bit about starting a geriatric program. First of all, talk about what is geriatrics. Can you define what that means?
Well, by definition, we think of geriatrics being patients age 65 and older, but it really is more than that. It's people who have very complicated health status, multiple medical problems, perhaps taking many medicines. So people younger than 65 can fall into that category as well.
All right, so our population is aging.
Yes.
Can you talk a little bit about the need for a geriatric clinic program at Gundersen?
Yes, and I think you're exactly right, Chris. That's why there is a need. Over the next 30 to 40 years, the population 65 and older is projected to double, and such that nearly 1 in 5 residents will be over 65 by 2030. So there is definitely a significant need, and that's only going to grow over time.
The time is now to get the program rolling. Now, we were talking before we started this program that even just giving you a title is kind of difficult because we say internal medicine at Gundersen Health System, and we're trying to, or you're trying to, transition that into more of a geriatrics program. What's going on?
Well, what we've been trying to get established is a geriatric assessment clinic. And we're looking at that as a consult clinic to collaborate with primary care providers to care for these older adults with very complicated health status.
All right, complicated health status. Explain what that means. Maybe talk about the kind of patient or demographic that you're looking for here.
Sure, and you know, it's usually people who have multiple medical problems. Perhaps they're seeing several different specialists for those problems, you know, usually on quite long lists of medications. And you know, that's really difficult to keep track of, even for a person who's not having any difficulty with memory, for example. And then if a person does begin to have some difficulty with memory, it becomes even that much more difficult.
Is this like coordinated care? Is that a way to describe this for this patient?
Yeah, yes, to some degree, and maybe I can tell you a bit about the structure of our clinic. You know, these are very prolonged visits. They're about 100 to 120 minutes per visit. And we have an interdisciplinary team of providers with us. And that's really the important part, I think. We're trying to bring these services to the patient at the visit. So we have a pharmacist working with us and then a social worker as well. So the patient and the family are getting all those services at one time.
All right, that makes a lot of sense, and it seems sort of shocking that maybe that's not happening, but in many places this is happening. It's just sort of new to Gundersen Health System. Can you talk about that a little bit?
Yes, so I did my fellowship training in geriatrics at UW-Madison, and the clinic we're trying to establish here, the Geriatric Assessment Clinic, is rather modeled off of what has already been established for about 20 years in Madison. It's just like I was mentioning, having the interdisciplinary team there at one time.
What are the roadblocks that you're running into?
Well, as with any new service or anything new at all, it's hard to get the word out there about it to providers who may be referring a patient, or out to the community and patients and family members as well. Because really what we're trying to do, the goal of our clinic is to help these older patients with multiple medical problems maintain independence. And whether that means adding more supports in the home or helping with a transition to a different level of care if and when that's needed. And what we really want to be cognizant of is not only the patient but their caregivers as well, because that's really what we're running into, is that these older patients, most all of them have a family member who's helping, and to identify the needs of that caregiver.
We're talking with Dr. Mary Bassing, internal medicine and geriatrics at Gundersen Health System, about how to start a geriatric clinic and program, which is she's been working on, and we just talked about the roadblocks. What's sort of the reaction when patients are going through this process? What are you hearing from providers, and what are you hearing from families that have been able to take advantage of this?
Yeah, it's been really great so far, and like I mentioned, we're just getting started, but the families we've had come through our clinic, they've been appreciative, more so of the time. Oftentimes in a regular clinic visit, there's so many things to address that there's not enough time to get to all of it. And we really are fortunate to have these extended visit times. And I think that that's what the family is appreciative of. And then the chance to interact with pharmacy and social work and have questions answered and do troubleshooting at that time.
And obviously the patients, as you're saying, will benefit from that. What are you hearing from family members who are, I don't know if the right word is, dealing with their loved one who is going through this process? What's sort of the reaction from them so far?
That's been very favorable as well, because we're, like I mentioned, we're really trying to identify caregiver stress and the needs of caregivers, and to put them in touch with community resources, caregiver support groups and that sort of thing as well.
Dr. Bassing, you mentioned time and the time commitment, but there's also something I understand about referrals. There can be self-referrals. Can you talk about both of those?
Yes, certainly. And we are a consult clinic. We're really trying to collaborate with the primary care providers, or even specialty providers, in caring for these older patients. And because what we found is that in a busy primary care clinic, the visit length oftentimes is not quite enough to address some of these problems and issues that the older patients are having. So we'd like to collaborate and help the primary care providers address some of the issues in terms of independence and needs for a different level of care perhaps. And outside of that, family members, caregivers, or patients themselves can refer to the clinic as well. It doesn't need a particular order.
And why is that necessary?
Because, I really feel that the patients and their caregivers, oftentimes the caregivers know much more what's going on with the patient's health status, and if there is even a subtle change, they're aware of it first.
They're dealing with that person or that patient, if you will, on a daily basis.
Yes.
Where do you hope this, you talked a little bit about the goals, but how long do you think it's going to take to establish a geriatric program and a geriatric clinic really at Gundersen Health System?
Well, right now we're piloting this for a half a day a week, and I would hope in the future that could expand. We're hoping, to get this really going with more referrals, more patients over the next year.
Yeah, how's support been from the administration? Because obviously they're looking around saying, we've seen this in other health systems, we need this here. I would think that the support from the administration is quite positive.
Yes, the support is quite positive, and like I mentioned, just being able to have a pharmacist, devoted to this clinic at that time, and also a social worker, that's crucial, and that I definitely feel supported.
It's a commitment from the organization.
Yes.
That's for sure. All right. Dr. Bassing, thanks for your time today.
Thank you.
All right. That's, again, Dr. Mary Bassing, internal medicine and geriatrics at Gundersen Health System.
Next, if you have leftover prescription or over-the-counter drugs in your medicine cabinet, there is a safe place to drop them off, and it's the only one like it in the country. You're going to find out next what it's all about on It's Personal, brought to you by Gundersen Health System.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, there's some new drop boxes that you might see springing up around the Gundersen Health System lobbies. And here to talk about that is the Comprehensive Waste Coordinator at Gundersen Health System, Eric Bashaw. Thanks for joining us, Eric.
Oh, thanks, Chris.
Let's talk about these drop boxes, because these drop boxes are one of a kind. They haven't been in any other health system across the nation, and they're for dropping off unused prescription drugs.
Yep, prescription drugs, over-the-counter pharmaceuticals, what we like to call dietary supplements like vitamins. We also are accepting pet medications, and then the medicated ointments and rubs can go in there as well.
All right, I know there's a lot of people that want to clean out that medicine cabinet. How do you do it? What's the process, and where are these drop boxes located?
Well, the boxes are located in our East Clinic Pharmacy. We do have one in our main clinic lobby. We also have one in our Onalaska retail store right off the pharmacy.
All right, so I've got these prescription drugs in my medicine cabinet, or who knows where. How do I get rid of them?
Well, the first thing you should do is take them out of their bottles. We ask this because it's easier to transport and store, and it also ceases you, once they're in the bag, it makes it clear that you're ready to dispose of them. There's no confusion. Put them in a Ziploc bag, and then you bring them to here and you just simply place them into the box.
Gotcha.
And then you can actually take the leftover empty bottles, just black out your information with a Sharpie, and empty medication bottles can go into the normal trash.
All right, so if I have a prescription bottle, I can just pour it into a baggie and then drop it off into the drop boxes. How do I know that those boxes are secure?
Well, we're very heavily regulated by the Drug Enforcement Agency along with the Environmental Protection Agency. We went through very special rigorous testing to make sure the boxes are unretrievable. So when you do put your medication in there, not even staff have access to those pharmaceuticals again. When the pharmaceuticals come out, it's under witness. We have to lock the drum right away, and then we seal it with a special seal that is not removed until it actually reaches its final destination.
And what is that final destination?
There's several facilities that we have options to ship to. We like to keep our options open in case one of the incinerators has some environmental compliance issue. It's down for maintenance. We actually use the same incinerators that we use for our hazardous pharmaceutical waste. It's a very high efficiency incinerator that actually burns at 99.9999% efficiency. And then we ensure that the ash from the incineration process is put into a specially designed hazardous waste landfill. We want to ensure that none of these pharmaceuticals get into our groundwater supply.
Well, let's talk about that a little bit, because I think that's really the idea behind this, is that a lot of people, hey, I have some leftover prescription drugs or vitamins or whatever. I'm just going to flush them down the toilet or throw them in the trash. Why isn't that a good idea?
Well, a lot of pharmaceuticals are meant to dissolve in water. Our bodies are mostly water, and so that's the main mode of entry. As soon as they hit any sort of water, they start dissolving, especially in landfills where they're just an open containment unit. So water gets into them, leaches the drugs through the soil and into our groundwater supply. A lot of pharmaceuticals, especially as they're developing, the focus is mainly on how it affects us when we take it, and there's not a lot of feasibility studies on what it does after it enters the groundwater supply. A lot of these drugs are very persistent. They're hard to actually break down through normal biological means. So,
all right, we're talking with Eric Bashaw. He's the Comprehensive Waste Coordinator at Gundersen Health System about new, I guess you call them drug drop boxes at some of the lobbies. And again, if you can list the locations.
Yep, our East Building Clinic Pharmacy, our main clinic lobby, and then our Onalaska retail store / pharmacy.
And the idea there is that you can drop off unused vitamins, drugs, or anything, I guess, over the counter that would you be potentially kept out of the waste stream, the normal waste stream. I think maybe what's really interesting to a lot of people is that this just hasn't happened previously. People don't know what to do with these things. So what's your advice to people at home who might be thinking of trying to get rid of this stuff?
Well, the first thing is to make sure that the medications you have aren't needed. That's one of the things we're really trying to stress is that we want to make it a process. You come to see your provider, you have medications or something in your pharmacy or medicine cabinet that you're not sure about, bring them in, ask a provider about them. They'll be able to tell you if you should have them or not, if they're expired, if they're not safe for you to have, and then you can dispose of them right then and there.
Is there a danger of having unused prescription drugs in your medicine cabinet?
Yeah, if you have small children, pets, drug abuse is on the rise. It's just something you don't want to leave sitting around. It's just a high value target and a threat.
You mentioned that you're working with several agencies. Can you talk about that a little bit?
Yes.
And sort of the regulation behind all of this, because I think people want to be safe.
Yep. And it's one of the things is people have always assumed that why can't healthcare facilities take pharmaceuticals? We work with them all the time, but we like to say the loop for us is closed. We can only handle the pharmaceuticals that we've actually been issued and that we dispense ourselves. So this is where the Drug Enforcement Agency in October passed legislation to let us do these collections. So we worked very closely with them to make sure that the boxes is safe, secure, and it meets what they're expecting to ensure that these pharmaceuticals don't enter and become a threat for drug diversion. We also work very closely with the Wisconsin Department of Natural Resources. They've been a huge, resource for us, making sure that how we're disposing these pharmaceuticals is in a safe, environmentally friendly manner.
Once again, if somebody has a prescription drug, or they have vitamins, or they have over-the-counter medications, you're telling them bring them in, get rid of them, but bring them in a plastic bag and take the old prescription bottles and get rid of them. But if you have something like cough medicine or something like that that's outdated, it's okay as long as it's sealed up.
It's okay as long as it's sealed up and you can place it in the container. Mainly it's just to keep the container volumes low to help keep the container from overfilling and allow us to be a little more efficient with the disposal.
And even though it's just the early days, I know that you've already seen an impact and some items have been dropped off.
Yep, we're after 1 week of a soft opening, we've already collected roughly 300 pounds of pharmaceutical waste.
So obviously there's a need in the community.
Yeah.
All right, Eric, thanks for joining us today. Appreciate
Thank you.
it. All right, Eric Bashaw, Comprehensive Waste Coordinator at Gundersen Health System. If you'd like more information about this, you can certainly go to our website, and there'll be information all over that. That's gundersenhealth.org. When we come back, we're going to talk about whether you should go to work or stay home. When can you go safely if you're sick? We'll find out more when It's Personal continues next.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, when you're sick, should you go to work? Or what if you just don't feel well? Should you still go to work? Dr. Joel Erickson from Gundersen Health System Urgent Care joins us now to talk about sort of what the rules are, or maybe the unwritten rules are. Thanks for joining us.
Thanks, glad to be here.
Talk a little bit about, there's a lot of people that go to work with the sniffles. How do you know when to go?
Yeah, it's a challenging question because there's no real standardized rules, especially when it comes to adults. There are some guidelines when it comes to children, and a lot of times the places like the daycares or the schools will have already written guidelines for parents to follow, so just simply kind of looking at that. But there are basic ideas. If a person has a fever, they're likely to be infectious, and that's something that you don't want to bring to school or work. A person is having uncontrolled diarrhea or vomiting or things like that, that's an obvious reason you wouldn't go to work. We in urgent care see a lot of different reasons for not going to work. We see people who come in with infectious stuff. We see injuries. We see just pain, things that keep people from being able to perform a job. Kids most often are here to see us because of illness.
What about that person who says, well, hey, I'm only going to be there for 6 or 7 hours. I can kind of, I can suck it up and, do my job today, and I really am not going to be in any major meetings or anything like that. What would you say to that person going into the office setting?
Yes, I think that happens a huge amount of times. And the thing I would say is I'd say, first of all, really make an assessment of who you're going to be working with, who you might be serving at your work, because what you bring to work, especially infectious causes, are definitely going to be shared. And you can contain how much you share that disease, but you can't completely stop it. And so it's important to think about maybe the age of the people that you're working with, what their immunity is, that kind of thing. A lot of people maybe work more isolated in a cubicle, and that is probably a little more appropriate to be able to say, I can keep to myself, I can make sure I keep good hygiene and contain how much I actually spread this.
Let's say no fever, feeling fine, but I got that cough. I've got, the sniffles or whatever, but I got a big day at work, got to go in. Is there any advice to that person that is going into the office that just might sound worse than they actually are? Or, what would your advice to them to be once they get into their cubicle world?
So I would tell them that a cough often is contagious. It doesn't mean that it's definitely going to be spread. The most important thing when we're dealing with cough is to control how you cough, making sure that you're washing your hands appropriately, trying to avoid some of the habits that we always do, like just immediately reaching out and shaking someone's hand. If you're using communal workspaces where you're on the same keyboards, really being careful to wash your hands with gel or whatever before you touch stuff. Those are the things I guess I would want people to think about if they have the common cold. It's spreadable, it's not the end of the world for most people, but you just really want to be careful how hygienic you are.
We're talking with Dr. Joel Erickson, Gundersen Health System Urgent Care, about when to go into work when you're not feeling that well, and then maybe we should also ask you about what about I'm feeling fine, I'm in the office, but Bob next door is hacking up a storm. What do I do? Do I talk to Bob? Do I talk to my boss? What do we do?
So I would always myself just try to be as careful to avoid that coworkers as possible. I would be sure that I'm doing the stuff I should be doing, washing my hands very carefully, and I might mention that, hey, I hear you're coughing a lot. You sure you're feeling okay? Do you think maybe you should take a day off and let this thing run its course? You might bring a mask and just sort of express to that person visually that you're a little uncomfortable with how sick they appear.
A mask for yourself,
mask
not
for myself,
for the coworker
yeah,
to protect
exactly,
yourself.
Yeah.
You mentioned kids a little bit, and I think there's a lot of us that have young kids who go off to school, not sure if they're feeling 100%, but they have a big day. They've got a field trip, or they've got something going on, and of course you yourself have work. What about sending the kids?
Yeah, I think what I use as a rule to myself and with my own kids is just to say, hey, if I don't mind another child, if my child was perfectly healthy and I don't mind another child who was exactly as sick as my kid playing with my kid all day, then I think that's a reasonable thing to send the child to school. It really still falls to the general guidelines of if a child's having a fever within 24 hours, if the child has vomited within 24 hours, if the child has uncontrollable diarrhea, if there's an unidentified rash that's associated with a fever, these are reasons that you really need to use prudence before you just send a child off to school. It is a contained environment, and stuff spreads really easily in that environment.
While we're on the topic of just not feeling well, how do you know when to come into the doctor's office, come in to see you, Dr. Erickson, in urgent care? When do I stay home? When do I bring the kids in? Yeah. What's sort of that trigger?
Usually, we will have a sense individually, like adults. An adult would know that either they have distractible pain, they can't do their things because the pain is intense. They feel very ill with fever, shakes, chills, and it's just going too long. How long? Really, that depends upon the person's underlying diseases. Do they have diabetes? Do they have heart diseases? Do they have immunity depression because of different medicines they use? And every person has to kind of understand what their underlying conditions are and how quickly to make a decision to say, I really need to talk to a doctor about this. There's resources like the nurse helpline that can sort that out a little bit better. When you're dealing with a child, it is more difficult. I think that you have to go with a parental gut feeling. This child is sicker than I'm comfortable with. I think several days of a fever is an indication to have a child evaluated. If a child is complaining of like a specific pain, for example, earache that's associated with a fever, then that's a great reason to have a kid checked out and see if there's other things that can be done for them.
Good advice. Can you talk about the difference between a bacterial infection, a virus, and the flu?
Yes. A bacterial infection, it's simply a different organism. Bacteria and viruses, it's like a plant and a mushroom. They're just completely different organisms. And so viruses, within the virus category falls this seasonal influenza disease that comes. And this is a condition that's a pneumonia. Oftentimes people get it mixed up for a stomach flu, like diarrhea and vomiting. The influenza that we all get the shot or the nasal mist for is a respiratory illness, and it can involve some diarrheal illness, and as we speak, this is starting to spread throughout our community, and we're seeing it. Influenza is a disease that comes with a rapid fever, a lot of muscle aches, some runny nose, will eventually develop into a cough, often has fevers that are pretty significant, and there are some medicines that can be used for treating influenza in the right kind of people that would benefit most from it. Usually those medicines are prescribed pretty early on. Usually they're reserved for the very young, very old, the immune compromised, lung diseases, other kinds of risk factors. Bacterial infections often are longer lasting. For example, people will often come in with sinus, runny nose, changes to the color of their nasal drainage, changes to the color of their cough. And unknown to a lot of people, that doesn't really help us to define whether it's a bacteria or a virus. Really the length of time, the level of the fevers, the underlying medical conditions that the patient's dealing with helps us determine more often whether there's bacterial infection. We have tools at our clinic too, like a chest x-ray or oxygen saturation, but a home tool that often is not utilized enough is just the thermometer.
Do you find that there are some people who will say, oh yeah, I've had the flu for a couple of days, but in reality there's the flu, which is really a significant thing that, like you said, body aches, pain, and sort of feeling like, oh my gosh, versus viruses and infections. Two very different things, or very separate.
Just to be clear, the influenza is a virus,
okay.
So it's just a virus that has a different clinical presentation than, say, upper respiratory infection, which has more head congestion, sore throat, drainage, but not as much fever, not as much achiness, just more inconvenience. I have a sore throat, I don't feel well. Influenza is a pretty intense illness in most people. However, being vaccinated against the influenza, which is probably one of our best tools to fight this, can reduce the symptoms. It doesn't always eliminate the possibility of getting influenza, but it certainly will often reduce how much the symptoms may present. So you might have a very different kind of presentation of influenza than another person because of your immunity, your vaccination status, and so it can be even tricky, even how certain conditions present.
Excellent points. Dr. Erickson, we're out of time, but thanks for joining us today and talking to us about going back to work or staying at home. Good advice to try and stay at home if you're not feeling well, it sounds like.
Glad to help. Thanks
All right.
for letting me be here.
Again, Dr. Joel Erickson, Gundersen Health System Urgent Care. But that's going to do it for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.